Okay, good afternoon, everyone, and welcome to today's webinar in our series First Nations Focus on Family and Relationship Services. My name is Lisa Curtis, and I'm the Policy and Project Officer here at Family and Relationship Services Australia, or sometimes people know it as FRSA. I'm delighted to be with you today and to be continuing this important conversation with you all. So before we begin, I'd just like to acknowledge the traditional custodians of the lands that in which we're meeting today. I'm joining from Ngunnawal country, and I pay respect to the Ngunnawal people as traditional custodians of the land and recognise any other people or families with connections to the lands of the ACT and the surrounding areas. As this is a national webinar, I'd also like to recognise the traditional custodians of the lands and the waters right across Australia and pay my respects to their ancestors, elders past and present. And I extend that respect to all Aboriginal and Torres Strait Islander people who are joining us today. I recognise the deep knowledge systems, the cultural practices, and the enduring connection to the land, waters, and community that continue to guide and inspire the work in the Family and Relationship Services Australia. So back in May at the FRSA National Conference 2025, we were privileged to hear a number of powerful presentations led by or developed in partnership with First Nations people. We're thrilled to be revisiting some of these presentations through this lunchtime webinar series. The series is a chance to reflect further on the practices, insights that were shared at the conference and to keep building our collective learning in this space. So today's webinar is Supporting Aboriginal Ways of Knowing, Being and Doing, Asset-Based Focused Service Development and Delivery. We're fortunate to be joined by Jaylene and Dr. Jen Cleary from Centacare Catholic Country, South Australia. Jaylene, can I please get you to pronounce the countries that you're coming from?
Yeah, so I am a Warrangal, Gugutha and Andigiri Maru Yankunjara woman. However, I am currently working on Bangala country.
Excellent. Thank you, Jaylene. And so Jaylene is currently working in Ceduna and surrounding communities in her role as the Community Development Officer with Centacare Catholic Country, South Australia. And Dr. Jen Cleary is the CEO of Centacare Catholic Country, South Australia, and an adjunct professor at the Centre for Social Impact at Flinders University, and is a specialist in place-based approaches to service delivery. So this presentation will showcase Centacare's shift to the centrally managed programs to community-led, place-based models that empower local communities, particularly Aboriginal communities, by recognising and building on their strengths. Through real-world examples, Jaylene and Jen will share how locally embedded community development officers are fostering trust, strengthening connections, and leading meaningful change beyond the traditional program constraints. We'll hear the presentation first, and then we'll move on to a Q&A and discuss with Jaylene and Jen. So without further ado, I'll hand over to Jaylene and Jen to take us through their presentation. Thank you, guys.
Thanks very much, Lisa, and thanks very much to FRSA for hosting this series of webinars. We're delighted and honoured to be able to present one of the things that we're doing in Centacare in Country South Australia. First of all, I would like to let you know that I'm coming from Bangala country. So I'm coming to you from Bangala country in beautiful Ware, and it's a lovely, lovely day here. Personally, I acknowledge, respect and recognise Aboriginal peoples as the traditional owners of the lands and waters of Australia. I recognise that spiritual, social and cultural practices come from their traditional lands and waters, and that they maintain their cultural and heritage beliefs, languages and laws which are of ongoing importance. And I continue to pay respect to the resilience and strengths of ancestors and elders, past, present, and those emerging. So, by way of introduction, Centacare is a social services agency delivering a broad range of programs and services, including things like family dispute resolution, family relationship counselling, low intensity mental health, financial counselling and wellbeing support, school counselling. So we have specialist counsellors in schools across our footprint, domestic, family and Aboriginal violence support, including a 24/7 safe house in Sejuna. We also provide foster care and residential care support for children and young people, and homelessness services, and a broad swathe of other services. And we cover currently a footprint of around about 980,000 square kilometres. And so that's really, the reality of that is it's most of non-metropolitan South Australia. And to put it into perspective, it's about 4 times the size of the state of Victoria. So as you can imagine, we spend a lot of time in planes and cars. And I'm currently in the process of working out how many kilometres I've done in my 10 years in this role, but I think the calculations are a bit beyond me. Also, another thing to add is that obviously in a footprint that large, we have our offices across multiple Aboriginal countries, and that really has helped us to understand the importance of place and connection to place, connection to country. And what we like to say is that we privilege people in place. We've come to that understanding of knowing that we need to privilege people in place over programs. And one thing we tend to say, it's become a bit of a catchphrase for us, is that our staff live where they work and they work where they live. So they're deeply part of our communities. In a footprint this large, it makes sense from a delivery perspective to also ensure that we are place-based, because we know that every community is unique, and we know that every community is there for a different reason, their reason for being, their community narrative, all of those things are deeply connected to that place. So just to show you where we are, I'm a geographer by training, so in anything I ever do, there's always a map, because I think it's good for people to have a visual of that. So we have 6 main offices and 4 satellite locations that are connected to those main offices. It's taken time, quite a long time, to build, I guess, the critical mass in each of those offices that enables us to support each of the communities within our patch and those satellite communities as well. And I guess the importance of place can't be overstated, in that, you know, it as a locally based organisation with people living in our communities, part of our communities, it builds a level, I think, of credibility, but also even more of a responsibility to ensure that we are responding to community need in a place-based way that centres clients, that centres community, and as I said previously, privileges people in place over programs. So we try not to get too hooked up on what the program is. It's really about what do people need in this place and how do they need to access it from us. But of course, place-based models can be really challenging, because we're required always to work within funding models which are primarily program-based and with program-specific KPIs. And I think currently we have around about 55, I reckon it might be 56, because I think we've just won another tender, but around about 56 different funding streams that come with their own KPIs, that come with their own acquittal processes, that requires us to manage quite heavily in the back end to support our place-based approach. So we kind of have to we have all these different funding streams coming in, and then we kind of have to massage it, and then we have to, and Jaylene is going to talk more about that. We have to massage it, and then we have to make it right to work in our communities. And as you can well imagine, that does create some difficulties in providing connected services that a client and client need centred in place. Again, it requires a lot of work at the back end, particularly in terms of the equittals processes. But what we recognise above all is that there, at the very local place level, there's a need to help all of this work. There's a need for what we call glue and grease roles. And I'm going to leave it there because Jaylene is going to talk more about those glue and grease roles. So the real work of this presentation is coming from Jaylene, who is the expert in this space. So I'm handing over to you now, Jaylene.
So further on to what Jen's just explained, we created place-based community development roles. So essentially these roles weren't developed for Centacare, they were developed for the communities in which we serve. Our mission has always been to serve the people. So these roles focus on community engagement, empowerment and connection. And we currently have staff in these roles in 4 communities, and all 4 positions are held by Aboriginal staff. These roles aren't tied to any program-specific funding, and staff are highly visible in their communities, and this creates the credibility and trust building, which means being able to connect more with community and clients. So further to that, on your left-hand side, you'll see Damien. So Damien's based in our Whyalla, one of our Whyalla offices. And then we have Nolene, who's based in Port Augusta. We have Jack, who is based in Port Lincoln. And then myself, who was based in Ceduna. However, since we've done this presentation, I've recently relocated to Port Lincoln and am currently working in a different role. However, the Community Development Officer role in Ceduna has been opened, and you know, we are encouraging local Aboriginal people to apply for that one. So who am I? As mentioned earlier, I'm a proud Wurrungal Gulgutha and Andigiri Maru Yankunjara woman. I have ancestral ties to the far west coast of South Australia, up through the Gawler Ranges, and then further up to the desert country around Coober Pedy and surrounds. So my journey within Centacare started almost 11 years ago. I was first employed as a case manager in the homelessness, generic homelessness service in Ceduna, so working, you know, with clients who were at risk of being evicted, or to support and help them maintain their properties. I did also do a lot of outreach to the Aboriginal communities outside of Ceduna, so Yallada, Kaniba and Oak Valley, and working with, you know, a lot of the transient people. So, as mentioned, I started off in the homelessness program. I then moved into a program manager role in our ABLE program, and then finally moved on to the Community Development Officer role. I became part of Centacare's Reconciliation Action Working Group, which is also known as RORG, in 2016. So the Community Development Officer roles essentially started as a conversation in one of our RORG meetings. Aboriginal staff felt as though, you know, during one of these meetings, we were all yarning, and we kind of felt like we were doing double the work, the job that we were employed to do. and then also providing cultural advice and knowledge to other staff, which in turn became a bigger job than expected. So after it took us a few years, but after that, having that conversation in RORG and really articulating what we were thinking out onto paper, and having the support of Jen to say, hey, wait a minute, we're onto something here. That's when, we were able to create these community development officer roles within these communities. So what is the community development officer role? So this role is to support the regional communities across Centacare's service footprint through various engagement and development activities, including community events, community meetings and networks, and supporting community organisations and stakeholders to engage with Centacare initiatives and programs. So this included assisting in the development of culturally appropriate, innovative and effective approaches to delivering services to families and individuals, providing clinical cultural consultation as appropriate in line with specific program needs, supporting the community, which includes individuals and families, to strengthen community functioning as appropriate as possible, and then incorporate community participation, community development theory, and client-centered practice. So, as well as, attending and actively participating in community meetings and networks as required, and understanding what's happening in our communities. So we continue to develop strong networks with stakeholders, service providers, clients and community. And lastly, on a day-to-day basis, we provide ongoing coaching and mentoring to support the students and staff members at Centacare. So when we say not tied to any program, as Jen mentioned earlier, the CDO roles aren't tied to any particular program. Therefore, it gives each site the flexibility to utilise these staff as needed, to continue to create relational currency between each site and their communities without the constrictions of funding agreements and meeting KPIs. So when we talk about the glue and the grease, we're talking about the community development officers themselves. We're essentially the glue and the grease to the organisation. The grease part is smoothing the way, as we are already part of the Aboriginal communities. Therefore, this creates trust, making it easier for people in community to connect to our services. The glue part is ensuring that it is done the right way. So when Centacare are embedding themselves into each community, the community development officers ensure that they do it the right way, the respectful way. This could be as simple as providing advice to staff on whether or not to facilitate outreach to communities when there is cultural business happening. So for example, let's say, Sejuna, there have been times when I've had to tell, our site manager will come to me and she'll say, hey, Jayla, are we all good to go to Yalata tomorrow? And overnight, I may hear of something that's happening within Yalata, or, I know that there's currently sorry business happening up there. So I'll say, nah, stay away. And, the site managers are really good at taking our advice on and working with us to ensure that we as an organisation continue to keep that cultural respect and keep that respect of the people in which we serve. So moving on, what does place-based mean in the context of the CDO role? So first off, we absolutely understand that every community is different. It's unique. So we may have similar issues or concerns for our communities. However, we're not all the same. We know the history of our communities because we are locals. Central to our approach is that our staff work where they live and live where they work, and are deep placed to support their own community. Community development officer staff are highly visible in their communities, are well respected, and this creates credibility and trust building, which means being able to connect more with community, service providers, and clients. So, you know, obviously everything doesn't run smoothly, and there have been challenges with regards to creating these roles. So some of the challenges we faced during the process of creating the community development officer roles were the fact that it was a loose role description and, you know, difficulties sorting KPIs, as we didn't really have a blueprint on what this looks like and how it would work within our organisation. So we took a chance and allowed the roles to evolve, adding in where we could over time. This allowed us to have the flexibility to make change where needed. And, you know, we're still currently reviewing what this looks like, and we'll continue to review what it looks like so that we have the flexibility to be able to evolve, you know, when we need to. So the funding, you know, Jen mentioned earlier about the funding for the roles. So this actually required creative thinking and I believe heart medication for our finance manager. We actually draw from multiple programs, and it's generally from the admin component of the funding that we get for these programs. The second point there is the perceptions of other staff. So it could be seen as not real work. Given that a big part of the community development officer role is providing guidance and cultural advice to management, case managers and admin staff, it kind of looks to some like we don't have real structure, as we don't hold a caseload or have any clients. And it could be mistaken for us just sitting and yarning. The reality of it is, Aboriginal people are natural storytellers. We're helping people without them even realising that we're helping. Community development officers are continuously looking at the bigger picture and what's best for our mob, our people, what's best for our communities and what's best for our organisation. So with regards to the reporting structure, because it's not program specific, all community development officers report directly to their site managers. Thank you for listening to our presentation. I'm just wondering if you guys have any questions at all for Jen and I.
Well, what I might do is I'm just going to kick it off, if that's okay.
Yep.
I just want to firstly say thank you so much to both Jen and Jayla for a really insightful presentation. You've given us a real lot to think about in terms of how we can centre Aboriginal ways of knowing, being and doing, and the role of the community-led and place-based approaches. My sort of first question is, I've just put it in the chat, is what's been the biggest surprise or unexpected learning from moving away from centrally managed programs to working more deeply in place? Has there been any big surprises or unexpected learnings?
I think that first and foremost, as mentioned, you know, we work where we live and we live where we work. So we are local people, and the Aboriginal people that work within these roles are quite well respected within their communities. They know what they're on about. They know the issues that our mob face. They know where they need to be in order to create better outcomes for our community, for our clients, for our families. You know, and it also gives us the opportunity to be able to have the capacity and not be constricted, I guess, by meeting program KPIs and all of that. It gives us, as the community development officer role officers, the flexibility to be able to sit on committees, to be able to be in spaces where our voices are going to be heard. And when we talk about bigger picture stuff, we're talking about the bigger picture stuff for our community. Does that answer your question, Lisa? Perfect.
Yeah, absolutely. Thanks, Jayla. We have another question in the chat from Christy. Jen mentioned earlier privileging people over place and the focus on what communities and people need. Do you have any examples of how this has transpired? Yeah.
Do you want me to take that one, Jayla?
Yeah. Yep.
First of all, just a slight correction. We say that we privilege people in place over programs. So, and that's I think a really important distinction to make. It's a great question. And I think one example that I can think of that's been really positive is in South Australia, we have 9 prisons, and 5 of those are in regional communities, so regional areas, and 4 of them are in the space that we occupy, so our diocese. 4 of them are in our diocese. There's one in Port Augusta and there is one in Port Lincoln where Jayla is based now. And understanding that there's a prison in your community and what that actually means in your community, for your community, and for what happens in that place has been an important learning and development for us. And so we've been working with the Centre for Social Impact, for example, and again, this is just one specific example, to develop some tools around helping people who, particularly those who are on short stays and those who cycle through the prison system, which tends to happen a lot in those 2 communities of Port Augusta and Port Lincoln. And we have been working to understand those needs because in many of our communities, social services based locally may have grown up out of a particular community. And in Centacare's case, that community is Ware. Ware doesn't have a prison. So there might not have been direct consideration, for example, when Centacare was first established 30 years ago, of the needs of prisoners. It probably wasn't on the radar because it's not part of that community necessarily. So Port Augusta is very different to Ware, and it does have a prison, and that makes a difference in that community. So it's been important for us to deeply understand those different nuances in community. And the prison population in Port Augusta is actually different again to the prison population in Port Lincoln. One of the practical things that we've done that is developing now is an app, and it should go into testing fairly soon. It's an app that allows the support staff in social services agencies, the court staff and others to directly connect with a service, but more importantly, to directly access appointments for any service in that community. Because one of the things we know also that complicates things is often people are released into the community, but it's not their home community. So they actually have no real connection or understanding of what's available in that community. So I'll finish there, but that's one example of directly responding to needs that are different in different communities. And I hope that answers the question.
Thanks, Jen. I might throw another one to you. Sorry if you can't hear me, Jen. I'll try and speak louder. Can you talk about or give an example of how members of the community themselves have helped shape or guide this service model? Any examples of how the actual communities have helped develop it?
Jayla, do you want to talk about the how we work with perhaps the Far West Coast Partnership, unless you can think of a different example that's better. But over to you on that one.
Yeah, no worries. So in Ceduna, we have an organisation called the Far West Coast Partnerships. So they essentially work with all the organisations in Ceduna. I guess they're the bridge between the community and the organisations that are in Ceduna. So what they'll do is they'll go out and they'll they'll capture the community voice on a larger scale. And then they'll bring that back to all of our managers, and then our managers, will obviously have conversations with us, and it kind of trickles down. Part of the community, and another thing that we had in Ceduna as well was, I mentioned earlier about having the flexibility to be able to sit in spaces and listen. So that included things like women's group, to be able to sit down there and yarn with the ladies and say, hey, what do you feel like Ceduna needs, or how do you feel like we can do things better? So it created, obviously on a smaller scale and just within Centacare and how we service our communities, but being able to sit in things like women's groups, being able to work with, the thing with me in Ceduna is I'm related to everybody. So I kind of use that to my advantage. So I would have cousins working in different organisations that ran the men's groups. So I would go to my cousins and say, hey, can you have a yarn with the fellas to see if, ask them advice on how whether they think men's group is working, or how we can better service to, deliver our services into communities. It also meant, me working alongside our managers to go out into the Aboriginal communities of Yallara and Oak Valley and Kinniba and sit down with their CEOs and have conversations on what they think that would be best for their smaller communities. We also have I guess it's like a committee or a yarning circle in Ceduna, where all the different Aboriginal workers from across all of those organisations come together, and we all sit down and we have a yarn on what what these mob are doing compared to what these mob are doing, and how can we work in partnership with each other to best service our communities. So it's always bigger picture thinking. It's always, having those conversations, having productive and constructive conversations on how we can always improve. Does that answer your question?
Yeah, I think so. I think though that listening and the deep listening that you're talking about, really informing the actual work you do, but it also it sounds like it influences how you're running your programs as well. So it sounds really great. Thank you so much for sharing the examples.
No worries.
Okay, one more final one from me. What advice would you give to other organisations considering a similar shift to the assets-based placed focus model?
Jen, you want to take that one?
It sounds amazing.
I think it is. There's a couple of things. I think Jaylene would probably say go for it, but I think I suppose from a leadership perspective, it's really about accepting that people know who they are. They know where they're from. They know what they're connected to, who they're connected to. They deeply understand. And I think from a leadership perspective, it is absolutely vital to trust and to recognise and to listen. So Jayla talked about, and this really has come from our, as Jayla said, from our Reconciliation Action Working Group. And it was really important for us to value what people were telling us, what our staff were telling us, and to recognise that they were really onto something, and to to actually take on the status quo, take on the way that we're funded, take on giving the finance manager a heart attack, although he's fine. He's a very healthy fellow. And I think bringing people in the organisation along for the journey. So Jayla talked about perceptions. It's really important that leadership is seen to be supportive, that leadership values and modelling that way of valuing what it is that people are telling us is important, what our staff are telling us is important. And, I don't feel like we've done anything other than really listen and then try and help create a reality that is helping us to properly conduct our mission in the communities that we're in. I guess that's probably the best way to put it. But anything to add, Jayla?
What I will say is I do feel like, because these roles started as an idea, or more so, I know I was complaining a little bit when we were sitting in this ROG meeting, and I was like, I feel like I'm doing two jobs, obviously employed as a case manager in the homelessness program, but then also continuously providing cultural advice and stuff to other staff. The pressure did get a lot, but if we didn't have this conversation in this meeting, it wouldn't have came about. And because of that, I feel like we're now paving the way for other organisations to potentially follow in this space.
I couldn't agree more. I think it's been a great example of, what did you say it was? 56 different funding streams for your service, trying to work out how to take that focus away from the actual grants to the actual people in place, prioritising the people in place. It sounds like a really incredible way of moving forward. And from what you've shared, Jayla and Jen, it sounds like it's good for your staff as well as the communities in terms of helping your staff not feel so overwhelmed with having that. What did you say, Jayla? Two roles in one.
Two roles, yeah.
Yeah. Thank you so much for sharing your insights and your experience with us today. It's really inspiring to hear about your work, and we really appreciate the generosity in which you've shared your learnings with us today. I'd also like to thank all of you who've joined on the webinar today for your engagement and the thoughtful question that was put forward. It's really wonderful to see the interest in strengthening our collective understanding and the practices in this space. So as I said earlier, this webinar is part of a series, and we will be continuing the series on. So we will be going back and looking at another couple of presentations that were delivered at the FRSA conference back in May. So if you haven't already, I'd really encourage you to go and look at and register for the upcoming webinars, and share them also with your colleagues and other networks as well. So the next webinar that's coming up is Improving Access to Justice for First Nations Families in the Family Courts. This will be on the 1st of October. And the presenters for this session will be Tracy Flintoff and Daryl Hayes from the Federal Circuit and Family Court of Australia. And the following session after that is Centacare Collaboration for the Safety of Women, which we held on Wednesday, the 15th of October, presented by Sarah Todd and Dorothy Crawley from Catholic Care Wilcannia Falls. So if you do want any more information or to register, the information can be found on our website in the events tab. events and training, tab, and you can just go down to webinars. So the session has been recorded and we'll make the recording available to you in the coming days. And on behalf of FRSA, thank you again, Jaylene and Jen, and to all of you for being part of today's webinar. We look forward to seeing you at our next session in the series. But until then, take care and enjoy the rest of your day.